right, welcome back, everybody. This is Nick,
This is Fei.
and this is
Creogs over coffee. So today we have with us Dr. Platt, who is a professor of obstetrics and gynecology and maternal fetal medicine at UCLA. And he is also the director of the Center for Fetal Health and Women's Ultrasound. Welcome, Dr. Platt.
Thank you very much. Glad to be here.
Dr. Platt. So we're here in Las Vegas at SMFM's annual meeting. One thing we've been asking a lot of our guests is what exactly are you most excited for this year's meeting?
Well, there's a lot of things to be excited for. I guess the simplest way is the future. We have a bright future ahead. I've been around maternal fetal medicine for a long time, actually almost since its beginning, and to watch the future in front of my eyes, the young people, those who are presenting outstanding papers today, and those who are sitting on committees and really setting the path for the future. Sure, there's a lot of nice studies I can talk about, but when you put it all together, it's about, we know that our subspecialty is very bright, and there's a lot of people that are going to contribute to take it to higher stages than we were able to do, and the improvement of and quality of care will change dramatically, with our hope that it's going to reduce maternal mortality and morbidity, improve fetal and neonatal outcomes, and really get to where we'd like to be or where we should be. Clearly, the United States needs to change its maternal mortality and perinatal mortality rates. And I think with the individuals who are really coming up, the trainees, those who are in practice in academic settings and general practices today, I have no doubt that they will change those statistics, improve them dramatically, and really make those of us who serve in a teaching role quite proud for the impact that they'll have in the future.
Dr. Platt, for our listeners who are mainly medical students, residents, can you give us a little bit of your background and how you became interested in obstetrics and how you ultimately found MFM and what your interests currently are now?
Thank you. Like many people, when you're growing up, you always want to be something. I never wanted to be a fireman or a policeman. I never wanted to follow my father in the business world. I emulated my pediatrician, and I really wanted to do the things that he was doing. I wasn't worried about the shots that he was going to give me. I wasn't worried about any enduring pain from it. But really, I watched his enthusiasm for caring for me and my siblings. And so I always thought about pediatrics. And I always thought I wanted to go to medical school, and indeed I did. And then when it came time to decide, was it going to be pediatrics, I always said that I wanted to do something a little different because I really wanted to do newborn medicine. And at the time when I was training, it was just the infancy of maternal fetal medicine. It wasn't even there yet, really. And I said I want to do something called neonatology. I always felt the neonatologist needed to know more about the fetus, and I was kind of interested in the fetus. And so I planned to go out during my time of interviews. I was going out for pediatrics, and I was only applying to pediatrics. I had done some research with an individual where I trained in Detroit medical school. I went to Wayne State University, and I worked with the late Dr. Alfred Sherman, who really is my major mentor in a sense of someone who's had such tremendous impact on the way I practice. And I kind of liked obstetrics, but I still said I wanted to do neonatology. I mean, people didn't know what that was. They probably didn't know what I was talking about. And so I went out in pediatrics, but I decided that I wanted to go meet an individual in Los Angeles who had developed the fetal monitor, trying to understand what's going on in the fetus. And that's Dr. Edward Hahn, the late Dr. Edward Hahn, who really was probably responsible for the major advances in fetal monitoring from the beginning to almost to where we are today. I don't think we've had that dramatic change since he first introduced it in the 60s. So he was at LA County USC Medical Center. At the time, they were doing 18,000 deliveries a year. Statistically, that's 1 in 200 babies born in the United States were born at LA County. And I had arranged, because I was interviewing in pediatrics at USC and at UCLA, but I had arranged for him to have to meet with me, which I thought was fantastic. I'm just a medical student. He was willing to meet with me. Well, I had a wonderful hour session with him, and he says, well, what are your plans? And I said, well, I'm going to do pediatrics, and I probably would like to do probably about a year of OB afterwards just to get a better understanding of the fetus. He says, you're thinking the wrong way. You need to think about doing it the other way. You better do obstetrics first and really understand it, because we're really doing a lot in fetal medicine already. We're beginning to really delve into the fetus as a patient way back in the early 70s. And so within 5 minutes, we're into this discussion, a half hour, 40 minutes. He says, just wait a minute. And he calls the chairman of the department, then Dr. Ted Quilligan. Hey, you need to interview this guy. And so before I knew it, I was interviewing for an OB residency. I had met everybody in their department, just, well, not everybody because they had a lot, but, and he was really encouraging me to think about OB. And I wasn't sure at that time. And so I had my pediatric interviews that week and went back and had a long talk with my former chairman, Dr. Sherman, and I interviewed other pediatric places. I didn't interview any other OB places. And he said to me, look, if you decide to do OB, stay here and we'll tailor make your program, which you can't do anymore. And we'll send you out to San Diego for 3 months to work with the individuals who developed the LS ratio with Dr. Bernersky in pathology, who's really the dental pathologist. Boy, that's pretty good. Let me think about that. Make a long story short, I flipped the coin and I ended up doing OB, and I actually stayed in Detroit. Then I went on to do a fellowship at USC, and the rest is history. I mean, I was able to develop my interest in the fetus, my interest in ultrasound, and following what you wanted to do. I think I'm one of the luckiest people around to think that I had a vision of something that really wasn't really practical at the time, but if you put your head to it, you can do it. And that's, as an old timer now, you kind of say, would I do something different than I did before? And I probably would not. And it's a blessing, and I'm very fortunate to do that. And I guess it's a message to any of the students and the residents is follow your passion. You follow your passion, you're going to get ahead. You can be the very best at what you are in the world if you follow that passion and diligent about doing it. So, I give credit when I was in San Diego with Dr. Lou Gluck, who developed the ALS ratio. We don't do amnios anymore. We've moved far ahead of that already. But he really reduced perinatal mortality significantly. I learned a little bit of placenta when I was there, but I learned a lot in my residency, my fellowship with Drs. Quilligan, Dr. Richard Paul, who was my fellowship director, my colleagues, and I had the great fortune to work with Dr. Frank Manning, where we actually developed the fetal biophysical profile. It's hard to believe that it's almost 40 years ago that we developed that test that is still used today. So it's a bit of luck, put it that way, but enthusiasm really makes a very big difference.
No, that's a really fascinating course, and I think very inspirational for our listeners, all of whom are trying to come up with their own ideas about what might change the field. I guess, Dr. Platt, you have a lot to pick from, but what would you say would be like your most important contribution to obstetrics?
Well, it's really tough. I mean, if you ask what's the most enduring, obviously our fetal biophysical profile is really withstood the test of time, and I give a lot of credit to Frank Manning for his vision and our ability to work together and brainstorm over each other and do those things together. I can't imagine anything greater than that in a sense when you think about contributions. But I've been blessed to write a lot of papers, books. My contribution in ultrasound and changing the face of ultrasound from something we called the radiologist to consult for us when we became the ones that did ultrasound. I like to use the expression that when real-time ultrasound came around, we were able to begin to use ultrasound differently. And I like to use a little parable that it's like having ham and eggs in the morning for breakfast. Before we used to look at that and say, okay, we had ultrasound and we referred it. But that ham and eggs in the morning for breakfast, think about it. The chicken is involved in ultrasound. The pig is committed. And so we've become committed to ultrasound. And look at what's happened in the last 30, 40 years of ultrasound, of what we use this modality for to change it. And so I've been very lucky to be in the cutting edge of ultrasound technology and publications and its use applications in OB and in GYN as well. The role it plays in genetics and in early markers of structural defects. I've been blessed to work with genetic companies in developing the non-invasive prenatal testing, looking at cutting edge. So, and I've been very blessed to be in some cutting edge things that I think have changed what we did. So, sure, the biophysical profile, that's a personal publication with Frank Manning and I that has withstood the test of time. Our ultrasound publications, our early NIPT, which clearly everyone recognizes has changed the way we look at prenatal diagnosis today. And, I can just look at the future and see what whole exome sequencing is going to do and advances in genetics. It's amazing. I just wish for you as students and residents and anyone listening that you would be as blessed as I am, but follow your passion.
Dr. Platt, with your career, I mean, it seems like you've probably gotten a lot of good advice and had a lot of good mentors. Do you have any advice for our listeners about going forward into this field?
As you know, Dr. John Queenan and I helped develop the Quilligan Scholar Program of the Pregnancy Foundation, part of the Society of Maternal Fetal Medicine. We did it because mentoring is extremely important. You can't just take, you have to give. And if you're really a teacher, you're really a teacher 24 hours a day, 7 days a week, and being available to your students, to your mentee. So the best advice is seek someone that you can talk to, seek someone that you can communicate with, seek someone that will listen, that will not control, that allow you to make the decisions that are be important for yourself, but there when you need them. I think it's extremely important to find those people because you heard me mention names because these were my mentors. These are the people that paved the way for me make the decisions. They allowed me to do things. They thought, well, you're so busy, you can't do this, you can't do that. If you get it done, you can do it. If you don't get it done, you can't do it. And they'd be right. But I've been lucky to do that. So find someone that's going to help you, find someone that's going to guide you. Don't find someone that's going to control you. You want someone that'll allow you to do the things that you think are important for you because it's only you that can live with those things that'll make the very difference. So being a mentor is incredibly gratifying to me. Our legacy is not ourselves, it's through our students and what we can teach and what we can share with. And a final message is there will be bumps in the road. And I'd like to tell people that I've had my share. But I don't use those bumps to fall down and lay flat and give up. You use the bumps to catapult higher. Use it as that bump that just to stand up and move forward, and you'll be much better, and you'll be able to achieve the things that you wish to achieve.
Dr. Platt, what keeps you grounded? What do you do outside of work to stay on the ground?
Well, that's an important part of it. There are a lot of things that I do. I'm pretty active in a lot of organizations, in a lot of community events, a lot of charities. I've started many foundations, the nonprofit foundations, to help others. The most important thing outside of work is the family. Can't neglect it. I'm blessed with a wonderful wife of many years. I'd get in trouble if I said how many on this little session. Um, I have 3 great children. I have 7 grandchildren. Um, that is an important part of what I do. I'm very involved with my religious organization, a synagogue. I go to services every single day. 6 in the morning, I'm there before work. I probably should do the exercise that my wife's already at the gym at 5 o'clock, but I'm there because that's part of that keeps me grounded. I do a lot of work with the underserved that way. I serve in a capacity, actually, as strange as it may sound, to help prepare bodies for burial. It sort of has a religious connotation to it, but it's the respect you show not just when you're alive, but when you're dead. I've involved, as you've heard, with the Quilligan Scholar Program, the societies that I've been very active in, the quality foundations. I love sporting events. You see me walking around here with my LA Rams hat. That may not be happy for a lot of you out there, but that's okay. They didn't win, so don't worry. But baseball, hockey, love hockey. Our kids played hockey. Kids played baseball. I coached baseball. And I think those are the things that make important. I have such a variety of things that I do that I don't have time to think about downtime. Go to bed late, get up early. As obstetricians, we don't usually need so much sleep. And I've been very blessed to travel a lot. And so I see the world and it takes a little break, but people ask me, how come you're traveling again? You're going to another meeting? You know what? I go to the meetings not for them, but for me. Because every meeting I go to, I may give a lecture, but you know what? I'm listening to my friends and the other people lecture, and I'm learning from them. So I think you stay grounded by realizing you don't know everything. You stay grounded by saying there's a lot we have to learn, and there's a lot to achieve. And we're in a time when we see. I don't know what the word retire means. I think it's a 4-letter word, but it's more than 4 letters. So I think you have to think about the things that keep you going and keep that family there. That's the strongest thing you can, and really that makes a difference.
Dr. Platt, living in a city with so many sports teams, most important question: Dodgers, Angels versus Lakers, Clippers.
Okay, so Dodgers is pretty easy. It's interesting. I'm from Detroit, so I still have some affinity to the Detroit teams. But that I've been in Los Angeles longer than I was in Detroit, you can lose some of that. So I'm clearly more of a Dodger fan than Anaheim. Why? Because they're closer to my house. So that's lesson number one. Clippers and Lakers, they're in the same place, so I can't use that excuse one over the other. Um, if you know that I'm probably maybe 5'9", I didn't do well at basketball. So I like going every now and then. So I enjoy both the Clippers and Lakers. Um, I'd rather a team that brings it up from the farm club rather than buy your quality people. I think it's always good to part trainees and watch them grow. I think we've lost that in sports personally, but I think that it's a little different when department recruits people away from other people. But I think when you're just buying people, it's not the same. So I don't have a big challenge between the two. The Lakers certainly have the bigger draw in LA, but I am a very strong LA King fan, and go to as many games as I can when I'm in town and watch it tremendously.
I was about to ask Ducks, Red Wings, or Kings since
Well, it's interesting in Los Angeles. It's such a transient type city. When the Red Wings play the Kings, the arena, Staples Arena, is probably 80% red jerseys, and the Kings are either white or black. So there's a lot of Detroiters sitting in Los Angeles. I guess after this point, I'm a Kings fan. I know a few of the Kings players and their family. We won't address how that is, but I think very clearly you're there. It's your town, and it's something. Well, this year is not their year. It's been their year in the past. It's like everything else, their cycles, and they'll just have to try harder next year.
Thank you so much, Dr. Platt, for coming on to this podcast with us. I'm sure, I at least had a great time hearing from you, and I'm sure our listeners will as well.
Well, thank you very much. I congratulate both of you for doing the service. I think it's a tremendous asset as residents to know how you can contribute to others, and I'm glad I could be here with you today.
All right, so once again, this is Nick.
This is Fei.
And this has been Creogs Over Coffee.
If you enjoyed this podcast, go ahead and find us on iTunes, Spotify, Google Play, or any of your other podcatchers. Go ahead and give us a 5-star rating and review.
You can find us online at www.creogsovercoffee.com, or on Facebook at Creogs Over Coffee, on Twitter at CreogsOverCoff1, or if you're a big fan of the show and you want to score some swag or get a shout out on the show, find us on our Patreon at www.patreon.com/CreogsOverCoffee.
Or if you'd like to contribute a topic, let us know if we made a mistake on our previous podcast, or you just want to come and say hi, you can email us at creogsovercoffee@gmail.com.